Feeding in Children with Down Syndrome by Destiny Johnson and Shanika Mixon.
Based on a study on the clinical identification of feeding and swallowing disorders in 0 to 6 month old infants with Down syndrome, it was indicated that 96 out of 100 infants referred for the study had some degree of oral weakness, pulling, penetration, or aspiration on a video fluoroscopic study.
What is Down syndrome? Down syndrome is a genetic disorder in which a person inherits 2 copies of chromosome 21 from each parent. Feeding and swallowing skills. Eating is a learned behavior. Acquisition of skills follows a progression with each new milestone building on skills of the previous one. If there is an interruption in this process, a feeding problem may develop. Dysphagia. Difficulty moving food efficiently and safely from the mouth into the stomach. Penetration and aspiration are results of the condition and not the condition itself. Infants and children with Down syndrome have structural and functional differences in the mouth and throat areas that make it more difficult for them to make precise movements. Difficulties while eating. Anatomical differences that are seen include small and narrow upper jaw, high palatal arch. Food may get stuck in the roof of the mouth if the child has a high palatal arch. Physiological differences that are seen include low muscle tone and weak oral facial muscles. The child may tire or fatigue with chewing during meals. Open mouth posture at rest may lose solids or liquids when chewing. Having a larger tongue size may result in difficulty manipulating foods and preparing them for a safe swallow.
Medical issues related to feeding consist of constipation, gastroesophageal reflux, and aspiration. GE reflux. Continents from the stomach come up into the food pipe. The muscle that is at the junction of the food pipe and the stomach is the lower esophageal sphincter. Happens when the muscle is not working well or the acid balance is not what it should be. Reflux disease should be a concern when you see signs of vomiting, poor weight gain, stridor, and apnea. Dysphagia. Swallowing dysfunction. Milk goes into the windpipe instead of the food pipe. Babies will cough or choke with feeds. Microaspirations or silent aspiration pneumonia, apnea, or stop breathing, blue spells. More than 50% of children with Down syndrome who are referred for a swallow study are identified with dysphagia. Many individuals with Down syndrome experience eating, drinking, and swallowing difficulties, which can potentially lead to life-threatening conditions such as malnutrition, dehydration, and aspiration pneumonia, especially as they grow older.
Children with Down syndrome can promote a safe intake by decreasing the rate of liquid intake, taking breaks between each sip, and pacing between bites to decrease overstuffing of food. To improve tongue movement, thermostimulation and tense co-facilitates tongue retraction because the tongue wants to find and move the cold sensation. Hide and seek. Place the chewy tube in different places in the mouth and have the child try to find it with their tongue or move the tube from side to side with the tongue. Put food on the outer edges of the lips and use tongue to remove it. Resistive straw games that work the tongue elevation and retraction.